actually feel like I'm in trouble because I'm Andrea. I'm Andrea if my father's angry, okay? But Andie the entire rest of the time. Okay, so obviously I'm coming last out of the Mosaic doctors, and it's after lunch and everyone's tired and you've had large amounts of information thrown at you already. So we're going to go through this a bit at a time. Please feel free to just move around a bit and keep movement going if you start to fade. Okay, so I've got two cases to talk through. First one is, we're going to call Jane. She's a 70-year-old female. There's no MSQ score on here because she has one symptom, okay? She can't sleep. It's very straightforward. She's the most extraordinary woman. If I'm as healthy as her at that age, I'm going to be very, very happy. But she's had 20 years of 4 hours sleep a night with her husband next to her, resting, happy, and she's sick of it. You know, enough is enough. And this started when she was menopausal. She was put on HRT at the time. She was of the era where she was on it and then taken off it when they thought it wasn't safe. But during the time she was on it, it made no difference to her insomnia. So no interest in going back on it, just would like to get a decent night's sleep. Functions extraordinarily well considering the lack of sleep she has, but she's well aware, she's a bright woman, she's well aware of the potential impact of having poor sleep for 20 years and what might happen in the future. She has seen an excellent nutritionist. I'm down in Poole and I'm very lucky to work with an absolutely brilliant nutritionist. So her blood sugar balance has been beautifully optimized. Her gut health has been focused on. She has stopped caffeine, nearly stopped caffeine, minimized alcohol massively. She eats like an angel. You know, if my parents ate like her, I'd be very, very pleased. So looking at her current nutrition, she has 28 different veg a week. I would call that a win, okay? Because she's retired now. It was a very successful businesswoman, and so now she needs a new focus, and her focus is her health. So she will literally make sure that she has 28, but they're not from the supermarket. You know, these are 28 really good vegetables and 14 different fruit a week. She has protein with every meal. She practices time-restricted eating. She doesn't have any additional refined sugar. She has 1 square of 100% dark chocolate in the morning because she's been told she can't have it in the afternoon. She doesn't have any caffeine in drinks. She has 6 units of alcohol a week, and understandably, she doesn't want to give that up. So I met with this knowing that she's seen this brilliant nutritionist thinking, what am I going to offer? Okay, so we had a look at a timeline. I don't know if any of you have used Living Matrix. It becomes a busy timeline even if not that much has happened. So this is not a particularly busy timeline. But the fundamental thing is she's been pretty healthy all her life. She hasn't had any children, but that was out of choice. She's a businesswoman through and through. She's at the time when she stopped being able to sleep, she also had some bowel symptoms. So that's sort of, oh no, I've gone wrong. What have I done? I've done something. Okay. Oh, there you go. I have no idea what I did. So around this time here, she had some blood in her stools, some mucus in her stools. This is back in the late 1990s. So over that time, she was given a diagnosis of colitis. Completely settled down, one off, never happened again, but that's about the same time as this trigger. She comes to me having been on various different supplements with a nutritionist, but by the time she comes to me, she's on some NAC, vitamin C, some omega-3s, vitamin D, and a magnesium with L-theanine and tryptophan. So, you know, pretty good baseline. Her matrix. If you look at this area at the bottom first, if we look at the modifiable lifestyle factors, as Izzy and Priya have already mentioned, you know, we focus on the lifestyle first. So what we've got there is that she's not sleeping. The majority of her stress is because she's not sleeping. So she perceives her actual stress as 2 out of 10. Again, we're all aiming for that really, aren't we? She does miss work, so she hasn't had an empty nest of her children leaving home, but she has had an empty nest of losing her career and maybe not necessarily having found her purpose going forwards. She does lots of gardening. She lives in a really lovely block of flats in Poole. There's quite a lot of flats in a seaside community, and hers has got these beautiful gardens, and she's very, very strongly part of maintaining those. So she's got this very close community that she feels very part of, but she would own the fact that she's not really worked out what her purpose is. And we can suggest all sorts of different activities, but that sense of purpose is a big part of who we are as human beings. So she knows that part of what she needs to do is find that again. And as I say, at the moment, her sense of purpose is being healthy, which is great. She probably needs more than that too. Okay. She did have some mercury fillings. They were taken out many, many years ago. That didn't coincide with any of her symptoms. She's got a family history of cancer. And really, you know, this is not a very busy matrix, I'm sure you'd agree. So we went on to do a metabolomics. Now we did this because I knew that the nutritionist had done a brilliant job with her gut. Okay, so I knew that doing a stool first may not add that much because she'd had such a lot done. So we went for the broad brushstroke effect. We also did that because of how sleep is created. So if you think about how sleep is formed, so melatonin being the hormone that triggers sleep. Okay, so think of melatonin as being a traffic light. Melatonin is your red traffic light. Just like with a normal traffic light, you are perfectly capable of driving through a red traffic light, but you know you shouldn't. Okay, and melatonin is like that. So it's not like a sedative, but it gives your body the trigger. It's time to stop. The majority of tryptophan is converted down the kynurenine and quinolate route. So if you only change by 1% down the other route, that's a win. Okay, you've got a big shift towards the melatonin side. So in order to move towards the melatonin side via 5-HTP and serotonin, you need specific nutrients and cofactors. So you need some iron, you need magnesium, vitamin B6, folate, you need SAMe, which is part of your methylation cycle. You also need to not have inflammation, stress, steroids. Stress not being the perceived feeling of stress. You know, if I say to patients, I'm sure you've done the same with clients, you say, I think this is stress, and they say, I'm not stressed. And you say, no, I'm not saying you're feeling stressed. Your body is under stress. Something is under stress, whether it's physical, emotional, spiritual, there is some stress going on at the moment. So we need to try and reduce inflammation and stress there. So we went on and did this test. This is back in 2021. So it's just before Genova changed how the results are viewed. So the first step is to check the creatinine, and if the creatinine is outside the normal range, then you can't really trust the results. So her creatinine, it is in the normal range, very just, but it is in the normal range. We then look at her digestive markers and measures of dysbiosis. This, in her case, is slightly complicated. In contrast to Izzy's case, this lady is eating a vast number of polyphenols. So some of this may well be elevated because of the vast number of polyphenols that she's eating. But those yeast and dysbiosis markers at the bottom, I think, are significant. Those are more than I would expect to see, particularly in someone who is eating quite as well as her. We then go on to look at her citric acid cycle. Now, I've been slightly bigged up here. Both of my colleagues have said I have a way of explaining this. So, you know, if you all think this is rubbish, then that's fine. Okay? But I look at this and I think, you know, we all went to college, university, and did training and got taught about this. And none of us found it easy. And we're sitting with a patient, quite often a patient who's got brain fog, and we're trying to get them to understand the concepts that are really difficult. So I tend to talk about it as if it's the M25. Okay, patients can envisage the M25. And you say to a patient, you're on the M25 at 4 o'clock in the morning, and you can just drive around and around. If you hit a traffic jam, then at the point of the traffic jam, your first thought is, what's happened ahead? Okay, is it roadworks? Is it an accident? But it's not what's happened behind you, it's what's happened ahead of you. Okay, and the citric acid cycle is exactly the same. So if you go back to hers, she has an elevated isocitric acid here. So instead of saying anything else, you look at what happens after that. And what happens after that is you need these B vitamins, you need magnesium, and you need manganese. Okay, and for the whole thing, you need iron. Okay, that's not marked on here, but none of this works without iron. And then the red blobs, for want of a better description, the red blobs are the things that make it go wrong. So they're your heavy metals. So that's the, are there roadworks or is there an accident? Roadworks, think about the cofactors that you need. Accident, what's blocking it, what's stopping it with your heavy metals. Okay, feel free to use that or never think of it again. So in her case, she's got this. So we're looking at those requirements or thinking about iron deficiency. So let's look at her B vitamins. Her vitamin B status, yeah, she's got some vitamin B needs. Okay, so that's, we're ticking a box there, we've got something. And if you recall, you need those B vitamins to convert the tryptophan to 5-HTP. We then look at her oxidative stress. So her pyroglutamic acid is extremely high. Okay, you need that to recycle your glutathione. So if you have got it very, very high, then that has an enormous amount of amino acid need to create it. You need magnesium, which we're talking about again, or it can be due to toxicity. There's some concern there for her. So then we go on to say, what impact is that having on her body? So these two markers, you've got the lipid peroxide, so what impact is it having on her lipid there, and her 8OH, which is the marker of DNA damage. In her case, it's not perfect by any stretch, but it could be a lot worse. With that high level of pyroglutamic acid, I would suggest that I would have expected this to be higher. So I was thinking, well, maybe that she's struggling with the amino acids to create the glutathione that she needs. Then we look at her amino acids. So on the left-hand column, you've got the pictorial representation of whether they're low, okay, or high, and they're all just about okay on that picture, although they're all on the lower side of okay, I'm sure you'd agree. But on the right-hand side, you've got this other bit on the report that I find really useful, which is saying, what are the needs? Okay, so 0 is 0 need. Okay, took me a while to work that one out. But 0 need. So if you look at that, she's got a really, really high number for glycine there. Okay. Now, glycine is a non-essential amino acid. However, pretty darn essential if you're trying to sleep. Okay. So it's synthesized from other molecules. There is evidence that suggests if you give glycine, 3 grams of glycine gives you a more refreshed sleep. How does it do that? It causes vasodilatation. Okay, so when you sleep, we talk about sleep hygiene, and when you sleep, you need to be in a nice cool room, which is why people don't sleep as well in the summer. Glycine causes vasodilatation, which reduces your body temperature and helps you sleep. It also increases your serotonin levels. And then just to be one of those wonderful design features of humans, glycine helps with acid secretion in the stomach. Now you need the acid to break down the proteins to get the amino acids to get your glycine, and then you need it to have the acid, so you get this vicious circle and that you then need to unpick. That makes sense? So I'm going to come back to what we did about that. Quinolates, we obviously are looking at how much of it's going down the wrong pathway here. In her case, her quinolinic acid at the second up on the bottom there is very high. So we know she's got far too much going down this pathway here. Okay, so that one being very high there. So we then plug that into her matrix. I put this in again because part of looking after people is tracking and seeing what's happening. So whereas she didn't have much in there before, suddenly this has got a lot more that we can look at, and there's quite a lot of it that's in this biotransformation and elimination part here. And there's quite a lot that's in this assimilation part. So then you got some areas to focus on, because we've got these really broad brushstrokes, and quite often in functional medicine and nutrition, you can take lots of different journeys to get to the end point that you want to reach. And so it's prioritizing, because we've got all the different areas to support. So what do you support first? So what do we do with her? She did have some anxiety about this lack of sense of purpose. So we talked about that, and essentially the anxiety came from the fact that she was awake. Okay, so she wasn't anxious in the day, she was busy in the day, she was exercising, gardening, cooking, but in the middle of the night when her husband's sound asleep next to her and she's awake again, that's when she was anxious. So we did a trial of Sensate. Sensate's quite a nice bit of kit that she wanted, something she could use in the dark in her bedroom with her husband next to her, and so we chose that. She does lots and lots of exercise, but we said, look, do more of it outside and in the morning. Okay, so we get the hormesis, and we get all the benefits of the morning light, and that switches your melatonin off so that you get your circadian rhythm as well. She invested in some blue light glasses. I say invested, £10 on Amazon. Okay. She started to have a little bit of protein at bedtime. So she's got this wonderful blood sugar balance, but she wasn't really eating a great deal after dinner. And the timing of when she woke up, we just thought it just might help to have a little bit of protein at bedtime. More fluid in the day, and obviously focusing on ensuring that she has a daily stool. Supplement-wise, gave her some B6, gave her some folate, decent magnesium glycinate, glycinate being a lovely form to help with sleep, so she took it at night time, gave some digestive enzymes. She was very nervous about the idea of any acid support because of her previous colitis, understandable. Because of her potential maldigestion, however, we gave her multivitamins in a liquid form and then some Saccharomyces boulardii to help with that fungal overgrowth. Hard to tweak her diet, though, to be honest. So we then did repeat testing, probably 6-8 months later. At this point, she's sleeping 6 hours a night. She was absolutely over the moon. Okay, I sleep 6 hours every night. I'm rubbish. Okay, but in her world, that was absolutely fantastic. So we took that as a win. She was very happy. So then we're going to compare what happened, and you can see here the difference in how it's changed and the way that Genova have changed the results view. And I think it is just a little bit more user-friendly on the right, so patients can see it in a slightly more clear way. But like always, these are people we're dealing with, and nothing's ever quite as black and white as we hope it's going to be. So, you know, here she had B vitamin needs. She's still got B vitamin needs. Okay, we haven't solved everything. Her citric acid cycle looks awfully like it did before. Okay, sure you'd agree. Her amino acids, difficult to say. Low normal and now low normal. Okay, so is there an improvement? So then you go on to here, and then you see the improvement. Okay, on this left-hand column, she suddenly actually has a vast improvement in her proteins, and particularly that glycine, which was through the roof, is now replete. Quinolates have also moved in the right direction. Okay, again, not perfect, but a definite improvement. So we can feel quite comfortable that her tryptophan is going to be having more of it going down the right pathway. And obviously symptoms are what really help us with that. So what do we do next? Next steps, she's decided she'd like to try some acid support, which is great. And we're going to work on her toxicity issue. Okay, so we really focused on the assimilation and we focused on that glycine, but biotransformation and elimination part, we decided she's going to focus on now, because really she's got this family history of cancer. She wants to reduce her lipid peroxides, and she's really focusing. She remains well, and her purpose is still her own health, but she's happy. That's great. So I'm going to do a second case. So this is Chris, very, very different. This is a young man in his 30s who's lived quite a life. Chris came to me with severe fatigue and brain fog. He was a very well-read young man. He'd spent a lot of time looking into what was going on. He'd done, I'm sure you've all seen it, he trawled the internet and social media to get the best results that he possibly could. He was a strict vegan. He worked as a pizza delivery driver. Okay, and I would suggest being a strict vegan and working as a pizza delivery driver takes a lot of self-control. Okay, he's an ex-IV drug user. He was an IV drug user for many, many years. From he started using when he was at boarding school, when he was quite young, and he had been in and out of hospital. He'd had a very severe osteomyelitis, so he'd been on intravenous antibiotics for a number of months. He'd ended up in prison. He'd had significant adverse childhood events, which is, you know, I'm sure you'd agree, not surprising given that outcome. Obviously not always the case, but in his case, he had these significant events. And he'd been clean for 12 years when I met him. He still went very regularly to, in his case, he chose Cocaine Anonymous, so he went to CA meetings very regularly and believed very much in that system and believes very much in the once an addict, always an addict theory. So he's very clear that I've been clean for 12 years and I'm clean today. Okay, which is a very mature way of looking at it. He I think he knows that he will always focus fully on something. And so his focus had become eating well and his vegan approach. His MSQ was 69, and given the amount of work he'd done himself, because his symptoms came on when he first got his pizza delivery driver job and was eating all the pizzas. Okay, so he'd worked that bit out for himself and had made some changes and improved things, and had looked into functional medicine and decided to go down that line. So we decided, he just said, what do we need to do? So we did a GIFX and a metabolomics on him. GIFX, he had, let me get the pointer. He had this Klebsiella oxytosa. This comes up as PP as potential pathogen. I think it's a pathogen. I think we should move it on from being a potential pathogen. I don't like it because when I find it and treat it, it makes people better. So we focused on that as something that needed doing. He'd got the presence of some candida there, and he'd got a really high secretory IgA. So very clear signs that his gut was really not happy, considering everything he was doing. So we did work on a 5-hour program with him. We're obviously not here today to talk about that, but he went through that quite well. He still had this very significant brain fog. So the thing with brain fog is it is another energy symptom. So when we talk to patients about energy, and when we think about energy, we think about, can you do things? Can you get up? Can you go for a run? How do you feel? Are you able to carry out your activities of daily living? But yes, of course, our muscles, particularly the heart muscle, use up an enormous amount of ATP from the mitochondria. But the ATP required for neurons for their neurotransmission is incredibly high. So when this is at the end of a nerve cell, they have to release the neurotransmitters, then they have to be picked up by the receptors. This process is a very, very energy requiring process. So brain fog is energy deficiency, even if they're an ultra marathoner. Okay. So in his case, he tried to make my life difficult for a while because he did this. He had the perfect citric acid cycle. Okay? That was really helpful of him. He then had no amino acid needs. This is a vegan, okay? I'm looking at these results thinking, come on. But actually, hats off to him. He was chuffed to bits that what he had done for himself was helping, and it was worth it. And putting that effort in was worth it. He was married with a little boy at home, and he was trying to make sure that his nutrition and his child's nutrition were well looked after. And he was putting a lot of effort and energy into it. And this is incredibly commendable, I feel. So what did he have? You can get add-ons with metabolomics. So you can get some toxicity add-ons. And we did those because he'd been injecting himself. And yes, of course, he'd been injecting himself with the drug, but the drugs don't come on their own. They come mixed with stuff. Nobody knows what the stuff is. Of course, you're going to have some toxicity here. So we looked into it, and he had this tin here. Okay. Now, again, you think about it and think, I've never used drugs. We've all seen films. And when you see films, what do they mix stuff up on? It's tin foil, isn't it? There's tin around. It sort of makes sense. Now, I don't know about you. I don't have a tin toxicity protocol. Okay. So all I see is there's something wrong because this is 12 years ago. So this is clearly not, it's not immobilized because it's got into his urine, but it's not okay. So we look at that. So when we think about detoxification, the majority of things we're looking at a 2-stage process. So phase 1 in the main is controlled by CYP450 enzymes. That creates your reactive species. And then you've got phase 2, which makes it into something that you can excrete, okay? And then you eliminate it, okay? So we talk about improving detoxification, but we always have to think about which bit of detoxification are we going to improve? Because if you improve phase 1, that's fantastic. But then you've actually worsened the situation. Okay, this is why we all love green tea, because green tea doesn't speed up phase 1, but it helps you. It sort of modulates your phase 1, but it does speed up your phase 2. Okay, so when we're looking at how to manage detoxification, you want to work backwards. Okay, they need to poo first. Okay, and pee and sweat and cry and do anything that gets stuff out. Then you need to get phase 2 working better, then get phase 1 working better. Okay, so it's backwards thinking, isn't it? And all those reactive oxygen species, they attack the cells. This is a very simplistic picture, but we all recognize what happens to fruit as it goes off, and it's a very similar thing that's happening to our cells. There's specific reactions that help with managing your oxidative stress, and they require specific enzymes. I put this on because I need simple ways to remember things, and I just think this is quite a useful way of doing it. So you've got these 3 enzymes that are particularly useful. They all have cofactors that are required. So when we're thinking about nutritional needs, we need to think about the cofactors to make these enzymes work. So you've got superoxide dismutase. Forgive the pictures. Again, small brain. I need these things. So you've got a cute zebra there. Okay, that's your copper and your zinc. Cute zebra. Go with me. Then you've got your manganese. That's your monkey. Okay. Then your glutathione peroxidase. You may not be able to tell it, but that elephant is sitting on his glutes. That reminds you, it's a glutathione peroxidase, and he's a very silly elephant. So he's selenium. Okay. I'm getting a frown or two here as well. And catalase. This is a cat doing the ironing. Okay, because for catalase you need iron. Okay. Literally just to help you remember this stuff. What I needed to remember it, but you need to think about all those things. And I think in functional medicine, we're really good at thinking about iron, B vitamins, magnesium, manganese. It's in the small print, isn't it? Selenium, that's probably somewhere up in the middle, isn't it? So it's just remembering that we need all of these. What did my perfect vegan need? Well, he needed some B vitamins. Manganese is okay, it's pretty good. There isn't any iron on there, so we did think about about how he's going to get his iron, because it is, as we know, harder, not impossible, but harder to get the iron that you need. We then think about glutathione itself. Glutathione is made up of 3 amino acids. The rate limiting step is usually cysteine. He's got plenty of all of these. He's got that toxicity, but look at that oxidative damage. How have you been an IV drug user for 12 years and still got it in the green? Yeah, that takes hard work, doesn't it? So this is all, it's quite reassuring, but his pyroglutamic acid is up a little bit, which I think would fit. Is this just a strain on recycling it? We've tried some NAC, so because cysteine being the rate limiting step. His MSQ is now 6, okay? His MSQ is 6 with little tweaks. Yes, there was some stress management we did in there. Life isn't straightforward for him. But with those little tweaks, it made an enormous difference for him. He's now going to be a functional medicine health coach. He's a great guy. So really, this stuff changes people. I think nobody's in this room who doesn't think that, but it's great stuff. Okay, so that's the end of my 2 cases. We're just gonna, if it's okay with Alex still, just have 5 minutes of just chatting about some things that we're looking to move into with Mosaic. So first things first, we are quite busy, which is fantastic. So we are looking to expand. The main reason we feel that is because as NHS trained doctors who, between us, who've been in the NHS for many, many years, we feel that we need this in the long term to be how chronic disease is managed. Okay, and so we the only way we're going to make those changes is if we're not working in silos, is if we are you know, a presence, and we can prove that what we do works, and we can audit what we do, and we can give evidence that what we do works. So we are looking at growing. We're not looking at growing fast at all. We need the right people, and so, but if that is something that you want to talk to us about, then do. You know, somebody said to us earlier, what do you need for it? Well, we just need to, the main thing we need is that we feel that you're part of the tribe, okay, because it's Mosaic's our baby, as you can probably tell. We are also looking to offer a nutritional therapy service for prescribing, okay. There's an awful lot that the nutritional therapists do that gives exactly what the patient needs, and sometimes they get limited by one thing. And I'm sure you've all got cases in your mind that you can think of that will fit in that criteria, and it's that professional to professional referral that we'd like to set up, where we'll enable you to refer somebody in with your most recent plan, report, however you communicate with your patient, you know, what you've advised them to do, what supplements they're taking, what nutrition they're following at the moment, and we use that as their sort of intake, and then we would see them. They're still your patient, but we would offer a prescribing service. Obviously, we need to assess and make sure it's safe prescribing, and then they come back to you, and they remain your patient. So if that's something you're interested, we have got some flyers in the other room, and you know, keen to chat. And that's me.